If you've been following along, welcome back. In our last video, we talked all about transition, which is the most intense part of labor, the point where things feel the hardest, but you're so close to meeting your baby. And now we are going into stage 2, to that final stretch of pushing your baby out into the world. I am Megan Walker, founder of Twine Doulas. I'm a birth and postpartum doula and childbirth educator, and I love helping moms find their strength in birth, discover how to rest in postpartum, and feel empowered by knowing exactly what to expect. Now, stage 2 is often called the pushing phase. It starts when your cervix is fully dilated to 10 centimeters. This is the moment that your body has been building toward. For many people, this phase can feel like a relief after transition, because now every contraction is helping you actively push your baby out. This stage can last 20 minutes to a few hours, especially for first-time parents. And if you've given birth before, you might go a little quicker, sometimes with just a few pushes. During this phase, your contractions will spread out just a bit, giving you small moments to rest in between. But sometimes they will bring like an overwhelming urge to push down. It's a totally different sensation than what you've felt so far. There's more pressure than pain, often deep in your pelvis, your back, or your rectum. You might even feel like you need to have a bowel movement, which is normal. Your doctor's probably down there wiping around you, making sure that you're not pooping everywhere. If you do have a bowel movement, this is your body working exactly as it should. It's guiding you and your baby through the last part for them to get here, okay? As your baby moves down, you might notice that there's a burning sensation, which is called the ring of fire, and it's as your baby's head is starting to crown. There's pressure that builds in your lower body, especially around your tailbone and your perineum. Your body might push naturally on its own, even if you're not consciously trying. So it's okay to let your body do what it needs to do. Some people feel empowered to push hard with every contraction. Others just want to breathe their baby down and are slow with it. And it all just depends on what happens in that moment. This is also where things might feel raw emotionally. You've been through so much already, and it's natural for fear, exhaustion, or even doubt to creep in. If you feel overwhelmed, lean into the support around you and let people know what you're feeling. They're here to remind you that you can do this, even when it feels impossible. Finding a position that feels right for you, whether that's on all fours, side lying, squatting, or semi-recline, will really help you during this stage. Your care team can guide you, but your body really knows what it's doing. So if it feels like you need to push, then go for it. If it feels like you need to rest, then take small breaks between contractions and breathe. At some point, your baby's head will crown, and soon after, their whole body will follow. And this is the moment that you've been waiting for. All the work, the effort, the intensity, your baby is now with you. And when your baby is placed on your chest for the first time, everything changes. That first touch, their first breath, it's a moment that you'll carry with you forever. Some people feel in awe, and others, it might take a bit for it to all sink in. In the next video, we'll talk more about stage 3 of labor, where your body delivers the placenta and begins its first steps towards recovery. So thank you for being here with me. If this video resonated with you, feel free to subscribe or share it with someone who might need it, and I will see you in the next video.